Hey everyone, Dr. Charlie, physical therapist here. Just want to shoot a quick video to answer this question of Dr. Charlie, who should I see first for my back, butt, hip, leg problem? Really insert any problem there, but my specialty is treating people with unresolved back, piriformis, sciatica type problems naturally using motion. If you're looking for a natural motion-based solution, then just visit www.calldrc.com. It's below in the description, and apply for a time to chat with me. So again, the purpose of this video is to help you decide who you should see as that first point of contact when you're dealing with this type of pain in this location, really any type of pain again. But the point is I'm going to use exactly, and I will post a picture of it here and we'll review it, the script that my patient received from their physician as she was dealing with some back stuff, who recommended PT. And the reason he recommended it is because she wanted it. She wanted a natural solution. It's just very interesting and somewhat aggravating to see the stuff that they put on there, and people believe that they are the experts. So we're going to chat about that. We're going to break it down, and I want to make sure that you don't get the same type of recommendation that my one client did, and that you can find the best solution for you. So we're going to review all that. I'm going to walk you through a step-by-step flow chart with some questions to consider and some overall concepts and beliefs to consider, such that you can find what's going to work for you. Okay, so if you're watching this video, you're wondering, what doctor or what specialist is going to be best to help me solve this problem. And while a lot of people don't ask me this, I know that it's a question, because when I go to any party or any gathering or anything like that, you hear people talking about their injuries, and everybody has their own opinion. So one person says, oh, you should get an x-ray, you should get an MRI, you should see the orthopedic doctor, it could be this problem, you should see this, it could be cancer, go right. So the point is that I want to provide some clarity about what the heck you should do from sort of an expert opinion standpoint, and hopefully you can find this valuable, and hopefully it saves you a lot of time, energy, and money. So you've got this question. The first thing you need to ask yourself is this. Really straightforward. Is your pain or problem reproducible or reproduced with motion? So 99% of cases are going to be something that involves a problem with the muscles, joints, or nervous system. And they're going to be reproduced or made worse with some type of motion, position, or activity. So how do you know if your pain or problem is reproduced with motion? Just ask yourself, are there certain things that make my problem worse? And then are there certain things that make it better? If your answer is yes, then you're in this 99% of the majority of people. Now, 1% of cases, they may have some type of cancer, tumor, fracture, infection, major neurological damage type problem. But again, we're talking such a small fraction of people, and this has other associated signs and symptoms, and there's not generally a really good motion-based pattern for that in those cases. So is your pain or problem reproduced with motion? If it is, if yes, then usually it's reducible with motion. That being said, the obvious solution is, if it's reproducible with motion, well, we could go get a motion-based solution, some type of exercise or motion-based therapy. The problem is that there are other options on the menu, if you will, and people get distracted and they go to the wrong place. Or in other words, they're hungry for one thing, but they go to the wrong restaurant. So I want to make sure that you don't go to the wrong restaurant. You don't start buying and eating all kinds of stuff that you realize is not what you actually want or need. So what's on the menu? What are your options for solving this problem? No matter the problem, you've got 4 options. I'm going to review 3 of them right now. And the 4th we already talked about a little bit, we'll cover it more in a moment, is motion. So we've got pills, shots or injections, surgery, and then motion. So look, if you want pills, injections, or surgery, or even if you think that's what you need, then who do you go to see? Well, probably pretty obvious that you don't come to the physical therapist, because at my restaurant, that's not what I serve. I can't do those things. So I know some things about them, but that's not my primary intervention. It's motion, right? So if you want any of these things or you think that you need them, that's fine. You go to the family doctor, the primary care physician, the orthopedic surgeon, the neurologist or neurosurgeon, pain management doc, right? And this is what they have. So you go there and they have a plate and they say, hey, here's what we've got. Do you want any of these things? And if not, they're going to recommend another option. The only other option for them to recommend is motion. So here's what happens when you go to the family doctor and you know that you want motion, you don't want pills, shots, or surgery, and they try to give you a recommendation about what that needs to look like. So, you know, if I, as a physical therapist, am a pizza shop, I don't know why I really like pizza. So let's just talk about this. If I'm a pizza shop, I can't give you a recommendation about the best type of Asian food, right? From a real, like, authentic expert opinion viewpoint, because like I'm the pizza guy. That's what my specialty is. So if you go to the family doctor and you want motion, and then they give you a script for motion-based treatment, physical therapy in most cases, don't believe what they're recommending, because it's usually just a bunch of garbage. Now, I say that with the most respect, because look, if you have an ear infection, if you have something else, if you have some fracture or some traumatic accident, you're going to want to go see some of these people. All right. But in the case of an ache or pain that gradually came on, you know, that is brought on with motion or reproduced with certain activities or positions, then these aren't your folks. All right. These people are not on the team from the sense of the first entry point. You might need them later down the road. Okay, we can chat about that. But here's what happens when you go to see somebody with this problem. So usually they don't do a very good clinical exam. This is the live script that I just kind of showed you, right, of the person who had back and kind of leg pain. And this is what they got. So this is what you're getting when you go to the family care doc. You know, please be advised that the above patient requires PT. So there's the script. You need motion, basically, is what they're saying. The reason: low back, left buttock pain due to lumbar radiculopathy, basically like a pinched nerve kind of idea. And then facet or joint arthropathy, basically irritation due to like arthritis generally. Precautions, that's the PREC, none. Frequency duration 2 to 3 times a week for 12 sessions. I don't know where they came up with that. That's just a rote cookie cutter kind of throw it out there. Goals: improve pain, function, decrease pain. I'm not sure what improved pain and decreased pain means, or if they're any different. I guarantee they just click some little buttons, whatever. Improve lumbopelvic alignment. They wouldn't know if you're out of alignment because they didn't do anything with you. But anyway, is there such thing out of alignment? That's another video. All right, RX, prescription. So what happens if you go to the family care doc, they hand this to you, then you walk into my office, or you walk into another PT or even a chiropractic, whatever. You walk into someone else's office and you say, hey, aren't we going to do these things? This is what the expert, they're not the expert. They're an expert in family medicine, internal medicine. They are, you know, an orthopedic surgeon is not an expert in what to do to solve your hip pain, back pain, piriformis, sciatic problem naturally. They do surgery and pills and shots. Anyway, so then you hand this to me and you say, aren't we going to do all these things? This is what, you know, I wanted to go to the doctor first, Charlie, to see what was really going on. And this is what they handed me. What do you think? Well, here's what I think. Useless. Doesn't help me at all. Because as you can tell, as I read through this, this physician has no idea and therefore has no warrant or ground to even be touching somebody with a problem like this with a 10-foot pole, because they clearly have no clue what's going on. How can I tell? Moist heat to facilitate an active program, PRN, as needed, and then ice afterwards. So I don't know, live on one extreme, try the heat. If that doesn't work, try the ice. Okay, well, which one's better? Well, I don't know, try them both. Lumbar, so low back, ROM, range of motion. So you need more motion, you need more flexibility in your lower back. Well, that might help you, but because we're not so sure what's going on, let's stretch. So let's lengthen, and then let's strengthen, shorten the lower limbs. Because again, we don't know, ice, heat, long, short, what do we need to do? We're not sure. Focus on hamstring stretching. Why? Because some textbook 50 years ago said that was the solution. So let's go ahead and do that. Oh, the core, by the way, there's no correlation between core weakness and back pain. So work the core because we're not so sure. And the glutes might as well. Oh, do some pelvic tilts because again, that's just what we did 50 years ago because we didn't know any better. Oh, now this is really interesting. So lumbar range of motion, remember we said that that's what was needed early on in the prescription by the physician. So get more motion in your lower back. And then it says lumbopelvic stabilization just a line or two later. So get more motion in your lower back, but wait, you don't want too much motion. You need it to be stable. So now stabilize your lower back. So what is it? Doc, is it they need more motion or they need less motion? They have no clue. Neutral or flexion bias spine program. And if you're going to stretch, only go this way because none of these ways could help somebody. Back education, whatever that means, proper lifting mechanics. Okay, again, just very generic cookie cutter terms. HEP, home exercise program. And then, you know what? Because we're not really sure what the heck's going on, why don't we throw in some soft tissue, some myofascial massage type based work, release, and neuromobs as needed. Neuromobs are basically nerve gliding or sliding. This person clearly is confused about what's going on. So is it a hamstring problem? Is it a core problem? Is it a glute weakness problem? Do they need more motion or do they need less motion? Do they need to be more stable? Do they need massage? Do they not need massage? I mean, this drives me absolutely crazy. The specialists that you're going to see, they know what they know. They don't know what you need if you don't want what they have. Don't go to the pizza shop and ask them about how to make tacos because that's not what they do. I get excited about this stuff and passionate and fired up about it because so many people are wasting their time, energy, and money going to these so-called specialists for problems that are reproduced with motion-based problems, and they're going to the wrong restaurant. Those people have no idea how to solve this problem with motion. We're going to talk about that more in a minute. So that being said, don't be surprised if you go and you get a very generic prescription. This means absolutely nothing to me. And all it means is that this physician has no clue what the heck's going on. And they wasted their time writing this because essentially I'm just going to rip it up. No disrespect to them. Just stay in your court. Don't be recommending specific stuff that you have no idea. If you want to talk about pill shot surgery, absolutely go see them. All right. Now, motion is the fourth option. We touched briefly on this. There are two buckets of motion, two categories of motion you could sort of seek out, right? You could go traditional and say, I want to go to someone who moves me. I want to lay on the table. I want somebody to do the calculations and the assessment, and I want them to kind of fix me, put me back in place, massage me, whatever. Now, kind of who fits in this category? Chiropractic, osteopathic, massage therapist, a lot of times physical therapists, acupuncturists, a lot of people fit into this. And look, there's nothing wrong with that per se. It's just that you have no control in that scenario because you go, it's your body, someone else fixes it, and then you have to live with it and walk around with it every day. And you're not sure how to solve it, how to fix it, how to make it feel better, how to make it feel worse, how to make it do whatever you need it to do because you have not been educated because you've been relying on other people. So go ahead, you can do that. That's okay. I'm not saying it can't work. I'm just saying, is that really what you want? Or is that the best solution? Well, here's what I found. So I used to do a lot of this. I was very osteopathic hands-on. And what we find is that, yeah, I was maybe good at fixing my patients in the moment, but my patients were terrible at fixing themselves. So the other type of motion now that I kind of emphasize is that I want to coach you on how to move yourself, how to evaluate yourself. Don't be fooled by all the fancy assessments when you go to someone to kind of figure out this problem, because a lot of it's based off of theory and a lot of it doesn't have a reliability from one person to the next. So you go to one chiro, they're going to say one thing. You go to another, they're going to say another thing. Heck, you even go to the other category of people, radiologists. You go to 10 different radiology centers for a back problem. You're going to get 10 different MRI results. Point is that you've got to take control of this. So I want to teach you how to move yourself and evaluate yourself so that you are in control. So you want to find someone ideally who listens to your story, understands motion, educates and empowers you with tools, knowledge, and understanding, addresses the healing environment. So if you've got a yucky environment that's constantly nicking the scab and keeping things from healing, you can go to all the manipulations or all the chiros or all the osteopaths or PTs you want and do all these exercises and not going to do anything. You've got too much debt, too much yuckiness in the environment. You want somebody who looks at the entire body. So a lot of times people just treat in the area of pain. That's okay. But a lot of times you will find more success by looking elsewhere at how the entire body impacts that area of pain. And then you want to follow a systematic framework for solving your issue. You want to test the body, treat the body, and then find some cause and effect behind what that treatment does such that you're not doing a million things at one time. And really at the end of the day, look, I don't care who it is, massage therapist, personal trainer, chiropractor, whatever. You want somebody who's a detective and a problem solver. All right. And again, that can be many people. I'm partial and biased to PTs. But again, there are a lot of PTs who, another video, just do all kinds of random things. And you might be saying, Charlie, I tried that, but it didn't work. Again, a topic for another video. So look, just some things to consider here. You know the menu. You want to ask yourself, right, how will the result of this evaluation, test, appointment, whatever you want to call it, change the outcome of my treatment? So if you know going in that you don't have a tumor, you don't have fracture, you don't have an infection, and how there are many symptoms that just through a subjective, you can kind of pull those things out, like through a story, listen to someone's story. But let's just say that you know that's not it, all right? Again, that's 1% of people, maybe. Okay, I know it's not those things, like I remember injuring myself or doing this thing or whatever. Then how will the results of an MRI change what I'm going to do about it? Do I want pills? Do I want shots? Do I want surgery? No, I already know before even going to the orthopedic specialist or surgeon that I don't want those things. So what do you want? If you want motion, then realize that those things aren't going to impact anything because you only have so many options. People think they have a lot of options to solve this. You've got pills, shots, surgery, or motion. You can go to someone who moves you or you can move yourself. Literally, it's that simple. It's as simple as choosing. So you have to pick the specialist, not on sort of what they tell you. People think that you have to go to someone and that they're the ones who are going to tell you what to do. Well, maybe, but they're not the experts. And I'll use another example here in a minute, in motion. So if that's what you want and they're not the experts in it, don't go there, right? If you get an MRI and they say you have a bulging disc, how's it going to change the outcome of your treatment? Well, do you want injections? No, I want to try, natural treatment. Okay, well, then it just leads you right back to motion. So you wasted your time, energy, and money. So what's the point of going down this route of whatever you choose, going to see the orthopedic doc or, primary care physician? You can choose any of those things. I'm not here to say, hey, you need to choose any of these people. I'm just saying, here's what makes most logical sense. And here's a framework to decide. So is it problem-based or are you just trying to find out what is it? What is it? What is it? What is it? Again, if it's not something life-threatening, you've got pills, shots, or surgery. So if you don't want any of those things, just realize that figuring out what it is isn't going to change the course of treatment. I know that's a belief. We'll talk about that in a minute, but it needs to be broken. Or instead, all that time that you're spending trying to solve the problem, figure out what it is, is it this? Could it be that? Yes, it could be any of those things. The whole time you're chatting, I'm just going to go ahead and start solving it. It hurts with motion, so let's just start moving the body and find out what works. That's your solution, and it tells you what the problem is. When I do this, this motion hurts. When I do this, this motion doesn't hurt. Okay, let's see if we can change that. Cool. All right. Now, the final thing, right, is really, and we hit on this, what do you want? This is the most important question to consider when you are going to, find someone who can help you on the journey to healing. So if you want a cheeseburger, we'll label that as pills, then go to the burger joint. All right. If you want ice cream, then go to the ice cream joint. Pills or injections. If you want surgery, maybe that's the fish. If you want sushi or you want tuna, then go to the tuna shop or the seafood restaurant or Red Lobster or whatever, right? But if you want pizza, if you want motion, then you need to go to a place that serves that, right? And that's the only way to get what you want. Otherwise, you're going to be disappointed when you go here and you get one of these other things. Now, that would make like really obvious sense in the restaurant analogy, but for so many people, they just can't grasp that I didn't want pills, shots, or surgery. I hate when I go, but they still want to go to the orthopedic surgeon or they still want to go to the family care doc. That's not what they do. So it's no wonder, and it's not even their fault. It's not your fault, but you need to be educated because this is just the way that society has sort of like, this is just the way things go for some reason, and nobody questions it. I think it's the weirdest thing in the world. Anyway, so now another email that I just got from a patient after chatting with them. Apparently I didn't do a good enough job educating them, but here's what I got. Let me just read it, and it proves this point, okay? As far as some beliefs that you need to break or challenge, because they are so ingrained in our world, in the way that we think about solving these problems, and it gets in the way of solving the problem. You will be like your own worst enemy when it comes to solving the problem. I can almost guarantee it. Again, it's not your fault, okay? So my case was a little bit different than expected. This is just an email I got like yesterday. Well, at least for myself, what I thought was a piriformis issue that I am at the end of my rope to solve and ready for your services. This person came in, was going down the problem solution or problem oriented route of what is it? They were going down the diagnostic rabbit hole and thinking that was going to determine kind of, what they did about it. And they asked me, after going through a little evaluation really quickly, 5 minutes, maybe that's another video. I can show you how to do a little evaluation, get an idea of where things are coming from. And I said, no, it looks more like, a stiff and painful hip joint, maybe an arthritic hip joint, something like that. She asked me, I don't like to spit that stuff out there because again, it leads you down a rabbit hole, which you'll see here. She's falling down it. So different than what I was expected. I thought it was a piriformis issue and I wanted your help, but now it's probably the limitations in the area of range of motion and not being able to raise my knee to chest, and it could possibly be arthritis. Okay. So my husband and I discussed this and found that this information changes where I am in my healing journey. I don't know why, but it did for them. Instead of being at the end, it is more like we were at the beginning because they think they now have a new thing and that the solution is different. We decided moving forward to make an appointment for an x-ray to see if this is possibly arthritis. By the time this woman gets an x-ray, she could have been better. But instead, she is so ingrained. She wants motion. You'll see this. See what PT they recommend as a first step. You can't go to the pizza shop and have them recommend how to make the best taco or the best sushi or whatever the heck you want to do. I love that restaurant analogy because it's so obvious. You would never do that, okay? Like you don't go to the financial advisor and ask them how to fix your back. So don't go to the person who does x-rays and the family care doc or the primary care physician or the orthopedic doc who does surgery and who does pills and injection and internal medicine and ask them what type of motions you should be doing. It makes no sense. You've gone to the wrong place. I am not a fan. So she's already telling me, go back to what do you want? What does she want? I am not a fan of meds or surgery. So the tools the AMA has to offer may be a short list. We are still open to your proven PT. We're going to see what we are actually dealing with. Crazy. I thank you sincerely for your informative call. I'm still interested in maybe working with you, whatever. From my past experiences, we may not find the solution with the AMA, blah, blah, blah. She already knows, and we already talked about this is all she's got, pill, shot, surgery, or motion. And she's already tried most of these things, and she knows that she doesn't want them, but she still is so dead set on this belief that the image will give her a diagnosis and that will somehow guide her to a different option. But it doesn't. It goes back to what do you want? She doesn't want surgery. She's already said it. She doesn't want pills. She doesn't want injections. So why are you going there? I can't say this enough. And that if you get a diagnosis, then the diagnosis will somehow equal, well, that should say treatment. Just change that now. Will determine the treatment that you get. And for her, she wants to see what PT or motions they recommend. They don't know. I'm the motion guy. I'm Mr. Motion. Ask me. Or ask somebody else that you trust. And another belief is that the family orthopedic doc is the specialist. Yes, they're the specialist in surgery, or they're the specialist in pills, or injections, or internal medicine, or neurology. They are not the specialist in motion. If you want a motion-based solution, and it is a problem that's brought on with motion, then you need to evaluate it with motion. And your best first step, in my opinion, okay, as somebody who does this every day and has treated thousands of people with these problems, is to treat it with motion. Again, this is a summary for anybody out there who is wondering, what the heck do I do? And who do I see first to solve this back, butt, hip, leg, butt problem? As you can see, again, I get fired up about this because you've only got 4 options. People are so dead set on trying to find what it is that they lose sight of what they want. And when they lose sight of what they want, then they go down the rabbit hole because they see something on an image and then that boxes them in. A diagnosis does not expand your possibility for healing, folks. It narrows you in, because if you have this problem, then don't do this and don't do this. And we need to do this. So if you're ready to break out of that box and you found this valuable and you realize that, yeah, I want motion, Charlie. I've been eating at the wrong restaurant and I want somebody like you to coach me so that I can learn to evaluate and move myself so that I'm in control, then again, just visit www.calldrc.com. You can apply to chat with me. Hopefully this was helpful. Just like or comment below. Hit subscribe if you want more like videos. And until next time, again, this is Dr. Charlie. I'm out. Take care.